Supporting kids with ADHD takes patience, understanding, and the right tools. That's where we come in. This is ADHD Connect with Dr. Tish Taylor, your go-to podcast for expert advice, real solutions, and encouragement every step of the way.
Hello, this is Dr. Tish Taylor, and welcome to ADHD Connect podcast. So today I'm going to be talking about ADHD and differential diagnosis, or ADHD and co-occurring conditions. So we often see ADHD in conjunction with other psychological, behavioral, academic disorders, or at least symptoms of those disorders. And in fact, it's estimated that approximately 20% of individuals diagnosed with ADHD are just solely have that diagnosis. So roughly 80% of individuals who meet criteria for ADHD also meet criteria for some other type of disorder that we would identify in the Diagnostic and Statistical Manual, which is the American Psychiatric Association Diagnostic Manual in the United States. So some of those presentations, I think, can be confusing to people, to parents, to teachers, and individuals themselves. So let me break it down for you a little bit, and this may clarify some of maybe what you're seeing, what you think you're seeing, or what you're trying to differentiate. And I would preempt this by saying that's why some people go and get more of a thorough evaluation, because they're trying to differentiate, is there more than one thing going on? Is it ADHD? Is it just ADHD? Is it something else, something in addition to? So let me give you some very common things that often co-occur with ADHD, and maybe this will help answer those questions for you. So the first thing is, let me just say the first category might be externalizing kinds of behaviors. So oppositional defiant disorder, if you have heard of that, that is a diagnosis that encompasses behaviors such as more temper outbursts, more resistance or defiance, non-compliance, more annoyance, being easily annoyed, annoying others, being agitated with others, trying to get back at others, those kinds of behaviors. So those kinds of behavior patterns. And so it's not really a clean, this is my personal opinion, this is Tish Taylor talking, it's not a very clean diagnosis because there are some different features to it, but the overall presentation looks to be non-compliant, easily irritated, easily upset, easily annoyed with other people, and then reacting as such. And so we see that in about, really, if a person is diagnosed ADHD combined type, or even I would say hyperactive impulsive type, we're seeing that in at least probably 50% of the cases, or around that. When it's just strictly inattentive type, we do still see an elevated level of ODD, but not to the same degree as we often see with hyperactive impulsive or combined type ADHD. And I do often say to parents, so if you listen to my podcast on the trait tool, you may see features of oppositional defiant disorder. The child or person may not meet the full diagnostic criteria, but you still may be seeing features of it. I would also let you know that that diagnosis is not diagnosed into adulthood. It is a childhood diagnosis. Another common, well, less common, but individuals with, usually you'll see it with ADHD combined type, not necessarily inattentive type, but there is some elevated degree of conduct disorder. Now that is when we're looking at kind of more serious rule-breaking behaviors, or the child is very willing to defy authority, defy rules, and get themselves into trouble. Right? They're typically in trouble at school. Eventually, they may be in trouble with the law, and they are definitely in trouble at home. So that there is an increased rate of that when you do see ADHD combined type, not nearly to the rate that you see oppositional defiant disorder. But if you do have a child who is showing those tendencies, I mean, it does make sense to start intervening there. You also see when you see emotional dysregulation. So that's we'll just say that that's not necessarily a diagnosis. Emotional dysregulation is not a diagnosis, but people talk about it a lot. And generally we're talking about regulating your emotions. I get upset very easily. My emotions seem big. I have big reactions to what appears to be smaller problems to most people. When a child is having tantrums or explosions, let me just say explosions, reactions, fits that are frequent in nature, that last a long time, and that are way out of proportion with what the trigger is or what has been occurring, intermittent explosive disorder may be a diagnosis.
Looking for expert-led courses, trainings, and tools to support your child with ADHD? The ADHD Store has you covered. Explore practical, research-backed solutions designed to help families and educators navigate challenges and build success at home, in school, and beyond. From behavior strategies to executive function support, you'll find the resources you need all in one place. Visit tishtaylor.com and check out the ADHD Store today.
Now, again, this is something that has to be very frequent: tantrums, explosions, fits that become aggressive in nature, verbally and or physically aggressive, and are out of proportion with what, the trigger is or the situation is. So if you're experiencing that, I mean, that's a pretty distressful presentation when you're living with that, but that may be a consideration. Something that is similar to that, but considered a mood disorder, and this was just introduced in the latest DSM, in the 2013 DSM revision, and that is disruptive mood dysregulation disorder. So that we consider, you still do see what I just described. You still do see elevated, more frequent and elevated tantrums, outbursts, emotional reactions to things that look like tantrums and fits. But what is associated with that is a more persistent, irritable presentation. So a more persistent, irritable disposition and mood. So this is often the families that are like, oh, we're kind of walking on eggshells, seeing what the day is going to be like. How are they going to wake up? Oh, I can tell what this is going to be like today. And trying to mitigate that mood. So if you're experiencing that, that you may look into that in terms of, are we having a mood disorder, which, of course, can have some treatment, both therapeutically and psychiatric treatment. Other things that can show up a little bit more often with ADHD is depression. So even milder variations of depression or mood, you tend to see that a little bit more with ADHD as well. And that is something that if you're seeing those tendencies in childhood, I would definitely monitor it in adolescence, because that tends to be a moodier time anyway. So, there's just more co-occurrences with ADHD. So that is something to monitor. Anxiety. So generalized anxiety disorder is typically in about 40% of the cases. So generalized anxiety is just really more, it's cognitive in nature in that there's more frequent worrying, future worrying, past worrying, worrying about making mistakes, just general worrying. And in addition to that, there's usually some symptomology like, it's keeping me up. The worrying is keeping me awake. I'm having trouble sleeping. I'm nervous. I'm jittery. There could be something psychosomatic. The anxiety is causing me headaches or stomach aches. But just some pervasive anxiety. There are other anxiety disorders as well, but that tends to be the most common one. Another area of often co-occurring conditions with ADHD is autism spectrum disorders. So from the autism spectrum disorder perspective, if a child is diagnosed with an autism spectrum disorder, then about 40% of those individuals also have a co-occurring ADHD. Now, it's not the same if you have ADHD. It doesn't mean if you have ADHD, 40% of ADHDers have autism spectrum disorders. That it's not that high, but there is a higher comorbidity rate with autism spectrum disorders and ADHD. But what I will say is lots of times there needs to be some differential diagnosis happening because there are some features that just overlap. So for example, we do see some hyperfocus with ADHD. That's not uncommon. So is it a hyperfocus like an ADHD hyperfocus, or is it a really more intensive, sustained interest that becomes, becomes more repetitive and more intrusive on other areas of functioning that we see in autism spectrum disorders? And so that can look a little murky, honestly, when you're just looking at a child and thinking, how does this fit? And what would you call this? That may be a situation where you want more, differential diagnosis or evaluation. Lastly, I want to mention learning disorders. So that would be a dyslexia, dysgraphia, dyscalculia, and we see in approximately a third of individuals with learning disorders, there's also ADHD and or vice versa. So it's not uncommon to have some learning difficulties different from some of the executive functioning weaknesses we see in ADHD. Right. So in ADHD, it would be pretty normal to say, a child is having trouble or an individual is having trouble keeping up with assignments, being organized, catching all of the things they're supposed to catch when the teacher's talking. Those are normal ADHD kinds of things that show up in academics. But some individuals, like I mentioned, have, maybe a co-occurring reading challenge. Math, written expression is actually, I think, pretty common, and there's some overlap with ADHD when it comes to getting things on paper and organizing that information. But so hopefully I've given you a good outline of those things from a psychological point of view, a behavioral point of view, a learning point of view that we often see in co-occurrence with ADHD, and what you might see presenting in a student, in a child, in yourself, in a person you know. So if you have any other questions, feel free to email me, Dr. Tish at tishtaylor.com, or check out my website, tishtaylor.com.
That's a wrap on this episode of ADHD Connect. Want more strategies and support? Visit tishtaylor.com for expert resources. And don't forget to subscribe and share. Until next time.